Bypass surgery, also known as coronary artery bypass grafting or CABG, is a common treatment for severe heart disease. It's performed when the coronary arteries, which supply blood to the heart, become blocked or narrowed due to plaque buildup. Here's how it works. Surgeons take a healthy blood vessel from another part of your body, usually the leg or chest, and use it to create a new path around the blocked artery. This allows blood to flow freely to the heart muscle again. Now, let's talk about the benefits of bypass surgery. A large study led by the Duke Clinical Research Institute found some impressive results. Patients who had bypass surgery along with medication therapy lived longer than those who only took medications. The median survival time for the bypass group was 7.73 years, compared to 6.29 years for the medication-only group. That's a significant difference of 16 months or more. But that's not all. The study also showed that bypass surgery reduced the risk of death from heart-related causes. Fewer bypass patients died compared to those on medication alone, 359 versus 398. For every 14 patients treated with bypass surgery, 1 life was saved. These are encouraging numbers that highlight the potential benefits of this procedure. Bypass surgery can also improve quality of life. Many patients experience relief from symptoms like chest pain and shortness of breath. This can lead to increased energy and the ability to enjoy daily activities again. However, like any major surgery, bypass surgery comes with risks. Let's discuss some of the potential complications. One common issue is an irregular heartbeat, known as atrial fibrillation. While it sounds scary, it's usually temporary and can be managed with medication. Some patients may develop infections in their chest or leg wounds, but these can typically be treated with antibiotics. There's also a risk of reduced kidney function after surgery. In most cases, this is temporary, and kidney function returns to normal within a few days or weeks. But in rare instances, patients might need temporary dialysis until their kidneys recover. Some people experience memory problems or difficulty concentrating after bypass surgery. This often improves over time, but in some cases it can be permanent. There's also a small risk of more serious brain-related issues, such as stroke. It's important to note that the risk of complications increases with certain factors. These include older age, having other health conditions like diabetes or lung disease, being a woman, as women tend to have surgery later in life, emergency surgery, and having multiple vessels grafted. But don't let these risks discourage you. For many patients, the benefits of bypass surgery far outweigh the potential risks. The key is to discuss your individual situation with your healthcare team. Now, let's talk about recovery. Most people make a full recovery after bypass surgery, with many returning to their normal activities within 6 to 8 weeks. But full recovery can take up to 3 months for some individuals. Before leaving the hospital, you'll receive detailed instructions on exercise, medications, follow-up appointments, and how to care for your wounds. You'll also be encouraged to participate in a cardiac rehabilitation program. These programs are designed to support you through your recovery, helping you regain strength and adopt heart-healthy habits. Speaking of heart-healthy habits, lifestyle changes play a crucial role in long-term success after bypass surgery. This includes following a healthy diet, getting regular exercise, quitting smoking if you smoke, and managing stress. Your healthcare team will guide you on making these changes to reduce your risk of future heart problems. It's worth mentioning that bypass surgery isn't a permanent fix. While it can significantly improve your heart health and quality of life, it doesn't cure the underlying coronary artery disease. That's why ongoing care and lifestyle modifications are so important. Let's recap the main points. Bypass surgery can extend life expectancy by an average of 16 months or more. It reduces the risk of death from heart-related causes. Many patients experience relief from symptoms like chest pain and shortness of breath. There are risks involved, including irregular heartbeat, infection, and temporary kidney issues. Most people recover fully within 6 to 12 weeks. Lifestyle changes and ongoing care are crucial for long-term success. Bypass surgery has come a long way since its early days. Today, it's a well-established procedure that offers hope and improved quality of life for many patients with severe heart disease. But it's not a decision to be taken lightly. If you're considering bypass surgery, have an open and honest conversation with your healthcare provider about the potential benefits and risks for your specific situation. But do not forget to watch our video on screen about angioplasty and stent, which are alternatives to bypass surgery. Thank you for watching our video on bypass surgery. We hope you found it informative and helpful. Stay heart healthy and take care.